So good evening, everybody. It's me again. Today, I'm going to uh, discuss about how, if you are a doctor or if you are a nurse, how do you going to take, or if you are a student, okay, you are a medical student. So how do you going to take pediatric, pediatric history? So always remember that not only in the pediatric, when you are in your pediatric duty, whenever you are in your surgery duty, medical duty or anything, a proper history can always arrive at the diagnosis. So any pediatric case record, right? This is very important. So what is the aspect of the pediatric history examination? The first one, of course, is you need to identify the biodata, the demographic profile. So always include the first component is the real name of the patient, as you can see here. The name of the patient, what hospital you come from, what is your age, what is the patient age, what is the patient's sex, what is the date of admission, date of your clocking, and also date of the discharge, and also who is the informant, the source of the referral, the address, and also the transport. How far did the how long and how far between the house, the staying of the patients, and also of the uh, hospital facilities, and what is the transport they coming by. And the next is the main thing. Why is the patient come to the hospital? What is the presenting complaint? Why the child come to the hospital? You need to ask. For example, he come with a respiratory infection. He may be say, I have fever for 1 day. For how many days? Maybe cough for how many days? Okay. So this is some of the presenting complaints. Always remember that when you doing your presenting complaint or the chief complaint, always remember to keep it short and precise, and always include the duration and the time, and put it in a chronological order, and it is very important. The next thing is you want to elaborate about your chief complaints. You want to elaborate about it. For example, the patients, the infants, the child come with the cough. So you want to ask what is the duration of the cough. Of course, you already mentioned in your presenting complaint. Then you need to ask about the onset of the cough, whether it is sudden, whether it is a morning cough, the nocturnal cough. Does the family member have any cough? So you can ask, is the cough associated with any other symptoms, for example, fevers? What type of the cough is it? Is it a whooping cough, barking cough, and etc. So it can help you to arrive at the basically you at the history of the presenting complaints, but you already generate some kind of the differential diagnosis, and you can from there rule out your different diagnosis. This kind of thing already must come into your mind. So this only is a good history if you can do that up to this point. So next you need to ask about the treatment received, either the treatment before or the treatment after. Of course, some may be arguing if you see about the systemic review. Some may be arguing about putting the systemic review in your history of the presenting complaint. Then after you come by treatment received and history of the allergy. But it depends on how would you would like it, just to make it systematically, and so you know what you are going to dealing with this kind of the diseases, or you want to present these cases to other doctors, so or other nurse or your college, so you need to know what things you are dealing with. So for example, the treatment received, you can ask before he arrived at the hospital what treatment he received, after he arrived at the hospital what treatment he received, and also the history of the allergy. You ask about the pets. Does they have any pets? Does they allergic to any dust, to any drugs, to any pollens, any carpets, any foods, and also seafoods particularly, and also is their house is there's a nearby nearby factory or not. Also, did they suffer for eczema? And can one of the causes of the atopic eczema, of course, is the one of the causes of the bronchial asthma, not the causes associated with bronchial asthma. And also, next you do about your systemic review, as I mentioned just now. Regarding the systemic review, you from head to the toe, you ask about the CNS, the CVS, your RS, your respiratory system, your GIT, your GUT, and also your musculoskeletal system, and also your skin. You ask about all these kind of things. For example, the CNS, you can ask about the order level of the consciousness, the drowsiness. Of course, in the infant or the child, you can't see particularly, you can't ask about the drowsiness because they may be always sleeping the all times, so you can't say the child is drowsiness or not. You can't is the you can ask other questions. For example, the irritabilities. How about they feel very lethargic or anything like that? You can observe. Okay. So you also ask about the past medical and surgical history. It's always very important in anything because maybe yes, this kind of same kind of a history before. So you need to ask about that. Maybe previous medical complication, anything you didn't ask. Ask about the birth history next. The antenatal history. Remember, ask about all these scan. Any, for example, did the mother suffer from any PIH, which is pregnancy-induced hypertension, the GDM, gestational diabetes mellitus, any anemia, the fetal movement, the birth history. All these can be help you to arrive at the score. For example, the perinatal. Next is the perinatal. You can ask about the baby is preterm or full terms. The baby, how is the baby delivered? Is the lower segment cesarean sections, or is it the spontaneous vaginal delivery, any venters, or the forceps deliveries? And always remember when delivery, you ask about the APGAR score. The APGAR score is particularly very important if the child have any cerebral palsy. Everything like that you need to ask birth episode, anything fetal distress. Okay. And the neonatal period. So what is the complication? For example, the neonatal jaundice. You can ask about the phototherapy, exchange transfusions. How many days the neonatal jaundice occur? So after that, any more complication in the neonatal period. So next, of course, is the immunization history. So always ask about the immunization schedule. Is it up to date, or is it, if it not out to date? So you need to know directly about the immunization history. For example, the BCG, how many months is given, the IPV, the inactivated polio vaccine, the HIV, Haemophilus influenza type B, and also your detect your diphtheria, your pertussis, and also your tetanus, and also your hepatitis B vaccine, your mum, measles, rubella, MMR, and anything like that. Some particularly maybe you can also put into specific mention the child receive any meningococcal vaccine, pneumococcal vaccine, influenza vaccine, everything. Maybe the parent care enough to give them, to take them to take the vaccine. So we don't know. So feeding and dietary history. How many months the infant have this exclusive breast milk feeding? Maybe it's common up to 6 months. Yeah, it's up to 6 months, but maybe more extended to that. Or maybe they have the mixed feeding. They combine the breast milk with other food, maybe with the formula milk. Which is the period they can start to weaning the food. Anything they can take the rice, eat the porridge, anything like that. Any feeding difficulties also need to ask. Poor sucklings, it can help you to arrive at the diagnosis. Any particular details is very important. Next, we ask about the developmental history. So usually 5 domain we ask is about the gross motor, the vision and the fine motor, hearing, speech and the language, and social, emotional and behavior. So if you want to understand more about this developmental history, I will bring you further into that. So So this is also come from the Malaysian pediatric protocols. So we identified the development milestone in the normal children. So pull to sit is head rate or round back. How many weeks can the baby pull to sit? How many weeks can the baby prawns? Okay. Pull to sit or everything like that. I just scroll through it. You can read yourself. Okay, if you want to read, you pause it and read. So gross motor, everything like that. Okay. Okay, if you want to read, you pause it to read. Because today is focused on the history examinations. So next, we going to interpretation of the development milestone. So after that, you interpret whether this development milestone is adequate to age, or it is not adequate to age. So you also need to ask about, next you come to ask about the family history. Always remember, plot a family tree here. So any genetic diseases, particularly you can know, for example the thalassemia, the Down syndromes, anything, the hemophilia, you can ask. And also, for example, the bronchiasthma, always brought a family history, which is related. Of course, you don't ask about the cancer. You can ask about the cancer, but it must be a related questions. Only you ask. Don't ask any unrelated questions, and include any unnecessary thing, as it can affect your diagnosis. Next is the social history. Any smoke history, okay, the transport, the financial situations, the house where you live, double story, single story, the transport, is the environment is crowded, do any family members or do any environmental neighbors have any similar conditions. So next, of course, arrive at your summary. Give some provisional diagnosis. The summary must be brief and precise and concise, so the hearer can straight know what you want to talk about the diseases. Next, of course, is followed by your pediatric examination. Depend on what system you want to examine. For example, you want to examine your cardiovascular system, then you do your inspection, palpation, percussion, auscultation, as always. So thank you. This is basically some information about the history taking in the pediatric case. Thank you.